Today, we'll go through the practical part of the medical care course, a course that every maritime officer should complete. Because there is no doctor on board, so every medical emergency is your responsibility to deal with. My name is Maxim Bochinsky. I'm a medical doctor. I work in emergency medicine and I've been teaching at Novikontas for already 3 years. In this video, we will cover 5 practical exercises. Doctor's ABC algorithm, care for conscious and unconscious casualty, bleeding control, including bandages, tourniquets and junctional bleedings, immobilizations of fractures, wound care and suturing, and nursing procedures, including injections. For our first exercise, we have a casualty who is unconscious but breathing. First, we have to establish that the situation is safe. After that, we check the response of the casualty. Hey, can you hear me? Is everything all right? Can you hear me? The casualty does not respond. We have to call for help. In the meanwhile, we have to open the airways and check for breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The casualty is breathing. We have to put him in recovery position. After that, we have to monitor the casualty and wait for help. Let's move on to a casualty who is unconscious and not breathing. This is to practice CPR. It all starts with danger assessment. The situation is not dangerous for us. We move on to response. Sir, can you hear me? Is everything all right? Call an ambulance, bring a first aid kit and an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. He's not breathing, we have to start CPR. Stand clear.
Shock delivered. Patient may be touched. Carry on resuscitation. Alternately, make 30 chest
10.
compressions and give 2 mouth-to-mouth breaths.
20. 30. 5, 6, 7, 8, 9, 30. For a patient with airway obstruction who cannot breathe, we have to perform specific maneuvers to clear the airway. One of them is the Heimlich maneuver. I approach my casualty from the back. I put my hands on the belly of the patient, I lean him forward, and with a hard push, I evacuate the object. In our next exercise, we discuss different ways to control bleeding, and we'll start with a basic pressing bandage on a wound in the lower arm. We'll start by applying pressure on the patient's wound with some gauze. And then we'll fix the gauze by making a pressing bandage. To finish the bandage, we'll create a loop and hide the loose end over here. For massive bleedings, which cannot be controlled by a pressing bandage, a tactical tourniquet can be used. We apply tourniquets on the arm, above the elbow, and on the leg, above the knee. This way, the tourniquet is now locked. There are 3 junctional spots in the human body, which is the neck, the armpit, and the groin, where the bleeding might be quite profuse and hard to control. So we have to learn specific techniques to stop the bleeding. Right now, we'll demonstrate the neck bleeding. I apply pressure on the neck of the patient. I ask my patient to look to the other side, and I'll start bandaging. Please lift your arm. And in And this way, the neck bleeding is controlled. Next scenario, amputation of the fingers. It is very important to control the bleeding. We apply pressure and we open the other bandage, which we're gonna use for fixation. I'm gonna hold it from underneath, anchor the bandage around the wrist, and apply some more pressure from the top. This is a simulated foreign object. The goal of the bandage is to prevent the object from moving inside the body. At first, we stabilize the objects with 2 bandages from the sides. And then we secure them with the 3rd bandage around the leg or the arm. Now, the object is stable. Bandaging a head wound is probably the most difficult technique out of what we have discussed. To control a head bleed, we need 2 bandages which are pre-tied together. We will place the knot on the side of the head and we're gonna unroll the bandages in the opposite ways. In the meeting point, one of the bandages will go on top of the head, covering the hair. And we repeat that procedure in every half circle. And the last step of this bandage is to uncover the eyes of the patient so that our patient can see. Our next exercise is using splints to immobilize a fracture. And we'll start with the fracture in the forearm. At first, we measure the splint and then we bend it to give it some more rigidity. Bending the splint makes it rigid. Now we place the affected arm on the splint and we will secure the splint with an elastic bandage. And the last step in the process is to apply a triangular bandage so that it's easier for the patient to hold the affected extremity. We start by folding the bandage in half. Then we have to measure the correct length by tying a knot on the side of the elbow. And we place the arm in the little hammock that we have created with a knot. And we're gonna tie the arm behind the patient's neck. And now we're going to demonstrate how to immobilize a fracture of the lower leg. For leg fractures, at first we have to place what is called an L splint. This is the splint that goes underneath the leg. We're gonna lift the leg gently and place the splint underneath. Afterwards, we have to place a U splint, which is the splint that holds the sides of the leg. And finally, we have to secure the splints with a bandage. Now, in real life, this procedure is usually done by 2 people. And now, it is safe to transport our patient. There might be a situation on board when a patient is wounded. And if evacuation to a hospital is not possible, it might be needed for the crew to perform the closure. To perform the surgical wound closure, we have to use sterile gloves. Regular medical gloves are not allowed. We put them on in a specific technique. After flushing and disinfection of the wound, we have to apply a local anesthetic, which is usually lidocaine, to minimize the pain. After that, we're ready to perform the closure. I use a needle driver, a forceps, and a pair of scissors. We insert the needle away from the margin of the wound. And we take the needle out from the subcutaneous fat. After that, we reload the needle driver and we insert the needle in the fat on the other side of the wound. Now we have to pull the suture through, leaving a short end. And our final step is to tie the knot. To keep things tidy, we have to cut the loose ends, leaving about 1 centimeter. It might be necessary to administer some medications on board, and for this we usually use an intravenous catheter. So as a last, 5th practical exercise, we'll demonstrate a venous cannulation. We start by putting on medical gloves. After that, we place a tourniquet above the site where we will puncture. We pull the tourniquet and we ask the patient to flex his fist. After that, we disinfect the area with alcohol swabs in a rotating motion, each time using a new swab. I take the catheter, I remove the safety cap, and then place the catheter in the vein. Now I remove the tourniquet and I secure the catheter in place with an adhesive. Finally, I flush the catheter with some normal saline. This is what medical care looks like in practice. We didn't cover theory in this video, but it is equally important. Every officer should understand not only how to do things, but why. The full course, both theory and practice, is waiting for you at Novikontas. Apply and gain the knowledge and skills which might be necessary to save a life, yours or the one of your colleague. See you at Novikontas.